Prasanta Chandra Mahalanobis Mahavidyalaya welcome all the participants in today's webinar related to mathematical models and wavelets. Before starting our session, I request our respected Principal Sir, Dr. Shamul Karmakar, to inaugurate the webinar. Over to you, sir. So, Principal Sir has not come yet.
Yeah, Karachi.
Am I audible?
Yes, sir.
Yes, sir.
May I start?
Yes, sir.
Yes, sir.
It's a moment of great privilege and honor for me to extend a hearty welcome to all of you, the students and participants today at this memorable event. I find immense pleasure in introducing our guest, Dr. Arni S.R. Srinivas Rao, Medical College of Georgia, the speaker of the day. Department of Mathematics of our college with IQAC of our college has organized this international webinar entitled Mathematical Models and its Impact on COVID-19 in collaboration with IQAC of our college. We are very much grateful that Dr. Srinivas Rao has agreed to join us as a resource person in this webinar. His area of interest is mathematical modeling, deep learning, probability, application in medicines, harmonic analysis, and artificial intelligence. Dr. Rao joined at Augusta University in 2012. Prior to this, he has a teaching and research experience at the Indian Statistical Institute, University of Oxford, Indian Institute of Science, and University of Guelph until 2012. He had permanent faculty position at Indian Statistical Institute, Kolkata. Earlier, he has won via Nakajima Award from Japan and DST Fast Track Young Scientists Fellowship in Mathematical Scientists, New Delhi. Dr. Rao, jointly with Dr. James R. Carey, has proved a fundamental result in stationary population models. Dr. Rao's work has also featured as news in the Math Digest of the American Mathematical Society. Dr. Rao worked as a consultant for the World Bank and other international agencies and has contributed for policies in epidemics such as AIDS, avian influenza, swine flu. We have entered already in a new world of virtual platform for lecture and workshops as the lockdown brought about by coronavirus. I feel proud and privileged to be part of this innovative and vibrant team of Prasanta Chandra Mahalanobis Mahavidyalaya. They are tirelessly working on how to enrich students with educational workshops and seminars to upgrade their knowledge. I congratulate them for their noble endeavor. I am very happy to share that the IQAC of our college had already organized different webinars during this pandemic situation. We received a large number of responses from teachers, students, and research scholars. It has also become clear from their feedback that the participants have been benefited by attending webinars. I take the opportunity to thank Dr. Kamala Mitra, IQAC coordinator of this college. Thanks also to the teachers of Department of Mathematics, Dr. Trisha Mitra, head of the Department of Mathematics, to select such a significant topic. Actually, mathematical modeling can be used to understanding how a virus spreads within a population. The essence of mathematical modeling lies in writing down a set of mathematical equations that mimic reality. These are then solved for certain values of the parameters within the equations. The solutions of the mathematical model can be refined when you use information that we already know about the virus spread. For example, available data on reported number of infections, the reported number of hospitalizations, or the confirmed number of deaths due to the infections. The process of model refinement or calibration can be done a number of times until the solutions of the mathematical equation agrees with what we already knows about the virus spread. The calibrated model can then be used to tell us more about future behavior of the virus spread. One outcome of the mathematical models is the predicted epidemic curve representing the number of infections caused by the virus over time, using different parameters in the model which may illustrate different interventions, or calibrating the model against different data can change the predicted epidemic curve. Since COVID-19 transmission started in the late January, mathematical modeling has been at the forefront of shaping the decisions around different non-pharmaceutical interventions to confine its spread in the UK. One model in particular, developed by Neil Ferguson's group at Imperial College London, has been widely quoted as the driving force behind the social distancing measures implemented in the UK and worldwide in order to halt COVID-19 spread. Mathematical modeling is designed to simplify reality and answer specific questions using relevant subsets of data. I had wondered how robust this mathematical model is, especially when the dataset they have used is only days, possibly a couple of months long. A mathematical model is as good as the data it uses, is a common sentence used among mathematical modelers. I have already lengthened my welcome address. Now I will enter into the attractive session, that is to listen to Dr. Srinivas Rao. Thank you all for being patient listeners.
Thank you, sir. Now, we are also very thankful to Dr. Rao that he has agreed to share his thoughts with us. Our participants can ask their question in the chat box during the lecture, and at the end of the lecture, we will try to address to maximum queries. Now, over to you. We can start our.
সবাইকে নমস্কার। আমাকে যখন এই ইনভিটেশন পেলাম ডক্টর মিত্রা থেকে, ভালো লাগলো। And Professor Mahalanobis College is very well known for all of us. And I want to thank Dr. Shamal Kumar Babu, also the President Dr. D.D. Majumdar of the Mahalanobis College, a very famous computer scientist. And when Dr. Mitra approached me, I felt so happy because I met her when she was a student back in some years ago when I was at faculty at Indian Statistical Institute. And we used to come there to this college almost every year for conducting the exams. And, you know, the Banugli near the Pukur, you know, that's a very great honor for me to get invitation to give this talk. And as Dr. Kamarkar nicely explained the beauty of mathematical modeling, he already explained to all the participants the nice things about the model. So this talk will be specifically on the coronavirus, COVID-19, and how the various mathematical modeling efforts I have been doing. That's what Dr. Mitra asked me to speak. The organization of my talk goes as follows. I will start with the artificial intelligence model, and then I will explain the mathematical model. And as we all know that when the coronavirus started sometime in January, although the cases were there in December, very few people expected that, very few governments all over the world other than China, they expected that coronavirus will lead to rapid spread as we are experiencing today. So back in January, I also thought as epidemic modeler that it is more important to identify the cases rather than to understand the spread at that time of that time period, January 2020. And then I designed a model to identify, because people are traveling in the flights, who is got infected with coronavirus, what are the symptoms. At that time, WHO and Center for Disease Control and ICMR back in India, they were all not very clear. I mean, many because it's a new virus. Then I thought of, developing, as I have been working on the epidemic models and developing models for in realistic time frame. I thought to develop a model that can identify the coronavirus based on the symptoms and signs. Then I looked at the CDC, WHO, and I realized that they have already given symptoms and signs and the travel history. So based on that, I first developed the AI model, and then I asked my clinical colleague after the model is developed. Dr. Joe Vasquez is a clinician and is a professor of medicine here in my college. And then I asked him, can he look into the model and can he participate, collaborate with me to make sure that, clinical things, whatever I'm mentioning in the draft are okay. Then I want to thank my colleague, Dr. Jose Vasquez, for accepting to collaborate. And then we both together published our first article back in February 2020, this year, to identify which are the cases that can be identified through a machine and through the algorithm. And then those identified cases, those who have a potential to have a coronavirus, will be asked to go to the nearest health center. So I will explain briefly how the model works. So in the first phase, we collect the travel history along with the more common signs and symptoms using the mobile-based survey. So once this survey has been conducted, given to the participants, all these participants have been asked to respond to this survey, and then based on the survey mechanism, all the data will be entered using apps. I mean, using the app, all the data will be entered into the hospital system. And once the hospital system has the data of all this data, then this particular data will be analyzed at the back end of, using the AI. So AI works at the back end. Phase 2, we have thousands of data points collected, and then all the data, what is being collected using an app, will be analyzed by the machine at the back end. And the machine responds within a minute to the respondent, whether the person has the symptoms or signs that the person had to go to the nearest medical center. And the person will be also given a sort of identification mark, so that that identification or some barcode will be shown at the hospital, so that that same person responded and same person need to be taken for the testing for the coronavirus. And those who do not have any possible chance of having a coronavirus, they also will be given information that the person is safe and no need to worry for the coronavirus. So this is the back in February. That's what we thought, the time is not to understand the prediction and the future, because even though I give millions of people, or hundreds of people, or 50 people, and we don't know who are there. So it is more important to understand the particular individual is infected, so that we can control the spread from that infected individual to the other individuals. That was the main purpose of this model. And pictorially, if you see that, suppose this is a geographical region, and then within a region, you see that there are households are there. These are the households, and then these are the households, and within a household, some of them are responding. In the next line, next part of the figure B, if you see that some of the individuals in the blue color, they are all responded, and some of the yellow colored circles, households within an individual, within a household, within individuals in a particular households have not responded. It is true that, in a mobile-based survey, all individuals need not respond. Then once we have the geographical region as in A, and then we have the data as in B, then from the A and B, we can able to understand how many individuals who have potential to have the coronavirus among those who have responded, and among those who have not responded, we don't know. We will never know. So only among those who have responded, only the model will be able to predict. And those who have not responded, they would never be able to trace unless they respond in the future, sometime in the future. So the second part of my model, when you see that, This is what the underreporting is about. Those individuals who never been diagnosed. So I will discuss that issue when I come to the second phase of my talk. So these are the description of all the. This is how the model works. In the blue are the individuals who have responded. Yellow are the individuals who have not responded. And then those who have responded also have potential to have a virus, and those who have not responded will also have potential to have virus. And then, I mean, I'm not going all the technicalities, all are there in the published articles. One can refer to them. They are all available online also. And this is one of the theorem, central theorem. We proved that given individuals who have responded, what is the probability that the responded individuals will be, what are the chance that the individuals will have a response? The probability that if they are identified, some of the individuals are identified, and the identified individuals, what is the chance that they respond to the survey? That's what this particular theorem. The probability that N1 cases identified through artificial intelligence framework, given that there are total number of individuals are there. So N1 multiplied by capital N by N square. That means in a region, given a region, we can find out from a city, from a region, from a from district, we can find out what is the fraction that how many cases can be identified in that particular region. And then I'm not going to the complete proof. The idea of the proof, if you see that, we have divided the population into those who have responded, set of U, those who have responded, and set of V, the individuals who have not been, who have never responded to any of the surveys. And U and V, this total, and then among the U and V, the individuals who have responded, total number of individuals are those who responded and those who have not responded. That forms a complete region, in particular district or particular county or state or whatever region, geographical region we consider. And then these individual subset of the total set. And then if we consider two events, E1 and E, E1 is N1 out of N responded cases, and E is the N out of N have responded to survey. So those who are identified, E1 is the identified cases and E1 is the responded cases. So what is the conditional probability that among the responded cases, how many are responded? I mean, given that so many are responded, what is the probability that some of them will be responded out of that? So total number of responded individuals in a survey need not, all the individuals who have responded in a survey need not have the virus in them. So this will give a chance that the individual, the AI model will only detect that potential cases who will be likely to eventually go to a survey center. And then we obtained from the probability that, as I mentioned in the statement, we proved that the probability that N1 cases identified through AI framework, given that there are N individuals responded. So how many probability to identify cases given that certain individuals responded is N1 multiplied by N by N square. And then this attracted, as I mentioned, I'm not going too much technicalities of the model. And then, as I mentioned, that this particular article, when we published in February, this attracted worldwide news media and various other organizations, because this is the first AI model for coronavirus that can identify individuals who have potential to have the virus. And then they can go to the nearest center, and then that way they can be quarantined if they are confirmed. This is the first major identification, because the virus can go to any individual. There are no restrictions. So this is a population-based pandemic spread. It's not confined to certain populations. And then this has been well reviewed by all the major, about 100 to 150 media outlets all over the world. They mentioned about this work. And one of them is, I selected only few of them, like Fast Company, which is like Forbes, which lists all the major technological innovations. So they also mentioned our study. And then the Campus Technology, which covers university-wide network of the various technology developments across the world. They also mentioned, and major news agencies in India, for example, Times of India mentioned on the March 5th that, the app is being used at home to understand the at-home risk. And the Jaguar, our regional Georgia regional, our Jaguar university level news article, news magazine, they also mentioned about that. And then Innovators magazine, Innovators Technology, they also mentioned, the app detects coronavirus risk. And the Economic Times also later mentioned, they also about this particular, how this particular app is going to help the identify the coronavirus cases. And my second part of my talk, I'm going to talk on the mathematical modeling aspect. So here my major collaborator is Stephen Kranz, and Steve and me, we have been collaborating for the last 3.5 years. And our first major article came in the Journal of Theoretical Biology. That is about the underreporting, because every individual who is having coronavirus or any other virus need not report the symptoms or need not ever report, like influenza, flu. We all get the flu, but only some of them go and report that they have a flu. So underreporting is very important. How many people not been reported, but they still spread the virus. So in that sense, these are the major articles we published. Our first article on India came in Current Science, which is one of the, as you all know, that this is a leading science journal in the India and read by all over the world. And then the AI model, other than the AI model, we also published underreporting of 9 major countries up to the first week of March. And then this particular article, Journal of Theoretical Biology, I mentioned all the harmonic analysis, complete detailed methodology, what we developed to understand the underreporting using the wavelets that is being explained in this article. And then few are other available online. And let me explain you the brief idea about what exactly we have done using the harmonic analysis.
In the technology world, as the technology is changing, if you learn something, if you develop a skill, you are not sure whether you can live with the same skill for the rest of
Sorry, was there a question?
No, sir, you continue.
Okay, thank you. So sorry, I had I would like to, if there is an issue at the AI model also, I would like to go back. That time also some disturbance was there, so I was not able to focus. I can come back to that AI model again if at the end of the talk. I'll be happy to go back there. So coming to the harmonic analysis talk, harmonic analysis part of the presentation. Here, suppose say that we have the time intervals are divided, like T0 at the beginning of the epidemic, and then T1, T2, T3, T4, and all etc. Tn. There are the time intervals during which reporting of a certain epidemic has occurred, suppose say. And then A1 in the first interval, A1 number of cases have been reported, but B1 are the number of cases which have not been reported. Similarly, A2 and B2 are reported, not reported, and so on over all the time intervals. Then the number of reported, number of not reported. Number of not reported, we will never know. And among the reported cases, suppose say that in the first interval, you see that here, there are 7 individuals are reported. And then this is a graph. Graph is certain number of nodes and certain number of edges. So in this is not a regular Euclidean graph. This is a graph, theoretical graph, where edges and nodes are there. Then you see that the number of individuals in the first column, the total number of infected individuals are same. This is 7, 7, 7. Whereas the individuals, particular individuals are different. So what I meant to say was, although we know that we know the total number of reported cases in an interval, we may not always know that who are that individual, what are the combination of the number of individuals. So it is not only the number of individuals is important. What we discussed was, it is that particular individual, who is that individual, that is also important to control the spread. So in the same way, you see the second column also, you see that this is just a pictorial description of the visual imagination of the reported cases. So in the second phase also, you see that the total number of reported are same in each of this second column, each of the boxes. But whereas the particular individual who is infected with the virus is different. That means that even though we know the total reported cases, that is not complete. First phase, that is not complete. There are still a lot of cases who have never been reported. But even though they are reported, even though we know the number of reported cases, that individuals also might be different. Same as for all these. So how do we adjust back to the proper intervals, and who are they? That's what one of the. So we proved a major theorem in that article also. I mean, out of several things, one of the things is that the size of each graph within could reach local steady state, and the global steady state equal to one of the local steady states based purely on the reported cases. So once we prove, that means the global steady state, if there is a global steady state, that global steady state would be equal to the one of the local steady states which you have seen in all these n intervals. And then these n interval data, whatever reported, suppose say this is the interval we consider, and this is say the horizontal axis, we have the cases belonging to a particular interval, and y-axis is the cases reported. So this is how the readjustment of the reported cases has been done in that article. So if there are individuals, these individuals are reported in that interval, they all belong to the first interval. And those in the second interval, some of the individuals are reported here, but those individuals, some of them are belong to the first interval, some of them are belong to the second interval. Similarly, third interval, those are reported. All the individuals who have reported in a particular interval need not have been infected during that interval. So this is how the reported data has been adjusted to the retrospectively to a particular interval in which they might have possibly got infection. This is how that readjustment of the redistribution or readjustment of the reported case done in the particular appropriate intervals in the past. And then the underreporting, I'll come to the underreporting study. So wavelets, the idea is that wavelets help to understand the visualization of the magnitude. We use wavelets here. Once we have underreporting has been adjusted, we use the wavelets to study the difference between the reported cases and total cases. To see the magnitude between the reported total cases, we use the wavelets. And as we all know that wavelets are nothing but improvisation of the Laplace transformations, but they are localized. They are all localized with the time and space. With both, they are localized. Hence, they are more powerful than the Laplace transformations. And then the assumption of this particular article on underreporting is that actual pandemic preparedness. We all know that the cases have been reaching in India more than 6 lakhs. So that doesn't mean that there are only those many number of cases are there. So actual preparation for the control depends on those who are reported and those who are not reported. This is what the idea of the this particular statement. Actual pandemic preparedness depends on true cases in the population, whether they are identified or not identified. As in the first part of my talk, you saw that is about the identification, and the second part of my talk, you saw this is about the understanding the underreporting. And what did we do? So we considered first, because in the first week of March, if you see up to the March 5th, we considered the number of cases in India. Almost there are only 5 to 6 cases were there, but in US also we had only cases less than 500. So many countries, except Europe and China and Korea, many countries did not have any large number of cases. So we considered the initial phase when the lockdowns were not very severe across the Europe or many countries, the lockdowns were not yet started that severely. We thought to find out the method we developed, which published, we thought to use that to understand the underreporting in these countries. So we considered first phase. China, Italy, Iran, South Korea, France, Spain, Germany, USA, although US did not have enough data. And then we consider the cases up to March 12th. These are the number of cases. And then the dates range for the first peak. So we have a range of dates, so January to February 4th, and 22nd February 4th for China, and then Italy, February 22nd to March 9th, and February 21st to March 6th. They are the range of dates where the first peak occurred. I mean, up to that, the reported peak, reported of the first peak, whatever the reported. And then other factors we considered were population density in those countries, in each of the country, and the urbanization, and the daily new cases reported. That means what is the frequency of the daily cases reported, what are the oscillations of the daily cases, and what are the time series data for the daily cases. And then the proportion of the population in these countries by the age group, less than 15, and 15 to 64, and 65 plus. That's what that's what the global data is about this particular age group. And then once we have the reported, once we have considered all of these, we saw that we predicted using the method that 1 in 149 to 1 in 1104 cases only been reported if we just consider only Wuhan data and project for entire China. And similarly for Italy, we have 1 in 4. And back in Iran, you have 1 in 34. And then South Korea, you have 1 in 4. That means for every 4 cases, 1 only been identified, and 1 in 5. And France, Spain, you see 1 in 53, and Germany 1 in 3, and US 1 in 406. That the data is very insufficient, so that was not a reliable estimate at the time, whatever we estimated at the beginning of March. And as I mentioned, we use the wavelets to understand which are improvement or Fourier transformations, to understand the difference between the whatever we predicted for underreporting, how these underreported cases and the true cases, they differ. And then interestingly, when we predicted the underreporting for all these 9 countries, whatever we have predicted for Italy, Germany, and Spain, they were all came out to be true 3 weeks prior to the actual data arrived. So when we predicted during the first week of March in these countries, then we see that end of March, Italy became one of the worst countries in Europe. At the time, you must have remember, all of you, that Italy was the first country which reported so many number of deaths all over the world that attracted them. People started taking seriously when the deaths have been increasing day by day in Italy. So we predicted that Italy is going to be this situation 3 weeks before that. Actually, Italy saw that. And then Germany, you see that we predicted Germany is doing good. That the identification has been much better than many other countries, hence they controlled. And similarly, the Spain was worse because they poorly identified the number of cases comparing the other countries. At the same time, when we predicted that, immediately the journal, when we submitted under review, the editor considered kindly because he saw that the articles, she saw that the whatever predictions we have done for these countries, they are coming out to be true. So they expedited the article and immediately they accepted it for publication, because that was lying with the editor for some time. And then when we saw the cases have been true, we mentioned to them this has been submitted 3 weeks before, and then this came out to be true. Yeah. And then because we saw that number of cases in the US, the number of cases were very low in the second week of March. But according to our prediction, there might have been 90,000 cases in the middle of March, although there were only reported 4,000 only cases. That is what the practical usefulness of this model. So when we published this one, we recalculated we visited back into the March data, and we found that out of 90,000 cases were there in the ground, only 4,000 have been reported. And that means rest of the 86,000 individuals, they were never aware of their status. That means they have been spreading, they could have been spreading into spreading the virus into the population. We don't know. So hence that's why the wavelets for the US data, if we see that the dotted lines are the data which have been reported, and the total number of cases, that's been the thick line is the total number of cases. And the predicted hospitalizations. So we have the another study also I have done it. I mean, come back to that. India at the same time during the end of March, we predicted that 1 out of 4 cases in India were reported by end of March. That's a big success because in India the lockdown started almost within a week. Within a week of the number of cases touched about 20. That's a major that actually could have prevented so many more new infections in the middle of March. So in the beginning, we thought that by 3rd week of March, it would be better to start the lockdown back in India, but they started a week before. And the results, whatever I found in the US, the lower estimate and higher estimate, and then medium estimate for those who have a prior medical conditions. That means these are the individuals predicted to have acquired coronavirus or COVID-19. Among the individuals, those who have prior health conditions, if there are any prior health conditions, what is that? How many of them would be having eventually the coronavirus during 3-month period, April to June? And then we divided the predictions by hospital admissions among the ICU and non-ICU. So, non-ICU cases are not important. And as soon as I found this study here, I communicated the result with ICMR back in India. And then I also shared that, those individuals who have prior health conditions, those who have 65 plus, they would also require, they would require more care to prevent mortality, to lower the mortality or to prevent the number of new deaths. Because the deaths among the individuals who are below 65 and those who do not have any health conditions, the prior health conditions, the mortality among them is much, much, much lower. So this study actually, helped to, global look at. So not only these 9 countries, I received also the requests from various other countries some countries in the all over world to help them to understand their own local predictions, formulate policies. Some European countries approached us to give us a policy. How do we make policy for them? What is the best way to reach a certain number of testing to be done? All such things we also provide a timely. So all these things, initial phase of the modeling, what we have done in the February, March, they help to initial level before lockdown started, how to formulate the models, how to formulate the policies, etc. And this study also, the second study also, mathematical study also attracted because it is able to provide the number of cases which have not been reported, but these cases have been there in the population. So, for example, the medical experts. I mean, this particular second study, about the mathematical modeling to provide correct number of cases, was also well received by across the world. And then the various news channels, for example, the Hindu Business Line back in India, they mentioned that India may be detecting 1 out of 4 COVID cases. That's what by end of March, that's what that means. And the Homeland Security, which is like internal ministry within the US, they also mentioned, this corona mathematical modeling, whatever we have done, that is drawing more accurate picture. And back in the Times of India and other articles back in Indian Express and many other news agencies back in India, all over the world, also various news channels, they also reported that this particular underreporting study would able to provide more accurate picture to the coronavirus back in the month of March before the lockdown started. Because once the lockdown starts, it is not easy to understand the various measures of epidemic spread because everybody is at home. The study designs were not accurate. The understanding the basic reproductive rate is also not very accurate. So these are whatever we have done before the lockdown period was able to help the lockdown preparations and the policies and then the understanding the spread and all these things. As you see that various things have been changing day by day. Every day we are seeing that new rules have been coming. And you saw just yesterday, there are many scientists petitioned the WHO that please declare coronavirus as also airborne disease. And then we are also editing, me and my collaborators are editing a special guest volume for the Journal of Mathematical Analysis and Applications, which is one of the oldest mathematical analysis journal. So this we are editing a special volume, myself and Stephen Kranz and Joan Nito. So this would be purely by invitation. And we want to cover across the world, various countries, we want to, the various country analysis, various levels, we want to cover as much widely as possible with the various different population structures, small population countries, large population countries, medium countries, and with different demographic age structures, different health systems. We want to cover as much as possible. Then those who have used innovative ways, innovative mathematical ways to understand the coronavirus and provided practical solution, not routine mathematical solution like a compute eigenvalues, understand stability, routine things. The mathematics can also produce routine local stability, routine analysis that can be done, but then which can practically useful for the ground level reality. We want to give a special emphasis for that. Yeah, and thanks for the attention. As I mentioned, there was initial some disturbance when I was explaining the AI model, but if you want, I can come back to that if the Dr. Maitra thinks. Thank you. Thanks for the attention.
Yes, sir, you can repeat that. We're very sorry, there was some disturbance.
Yeah, okay. Thanks. Yeah. So quickly, I would like to go through again this AI model. The AI model has two phases, and I would like to explain the first phase of the AI model is about the data collection using an app. And then that app collects the data based on the travel history and common signs and symptoms using the mobile phones, using the online survey, the first phase. And the second phase of the model is about using the data collected using the data collected through apps to health system. The AI model sitting at the hospital would able to give within a minute. Using the user, he or she will receive within a minute an alert that no need to worry, or you need to worry and go to the nearest center and where to go. So this will be geographically mapped using GPS system, so that the individual would not have to one individual sitting in Bombay need not have to go to Delhi, or somebody in Banugli need not have to go to all the way to some other in the central Calcutta. So they have to go to nearest hospital. So this will have a mapping system where the hospitals are mapped, hospital data and public health information, corona testing centers, everything will be mapped into that. And then the individual can go to them. And also the system, if there is an individual cannot travel, then mobile facility would reach that individual. So these are about two phases, data collection and the data interpretation. And then as I mentioned, there are if you have a geographical region, and then within the region, the households are there, suppose we distribute the households, and then the individuals in households are asked to respond to the survey. And all the individuals may not respond. And then the individuals, those who have not responded, some of the individuals might also have the virus in them. As you see that some of the yellow individual here, this individual has not responded, but that individual might have the virus. We don't know. So the individuals who have never responded, we never know that what is the status, or never responded and never gone to the testing. We would never know the status unless that testing has not been done on them. So the model would identify those cases who have been responded. So this is a summary of the idea of the modeling, idea of the AI model. Yeah, and the theorem what we proved was, if there are n individuals in a region, suppose there are we take an individual in a region, so we take a Baranagar area, and then we have n individuals in that area. And then the probability that N1 identified cases through the AI, what is the probability that the small number of individuals identified through the AI framework, given that there are so many N1, N individuals, I mean small N individuals responded, given that means a small fraction are identified, what is the probability of identifying a small fraction of individuals among those who have responded? That is what is such probability. This is what this particular theorem says. And then we considered, as I mentioned, the N and M cases are individuals, those who have responded and not responded. And total number of individuals are N equal to N plus M. That means in a Boranagar area, the individuals are responded and some individuals not responded. We don't know the ratio between N and M. Some are more maybe individuals responded and maybe less number of individuals responded. But total individuals in a Boranagar area is equal to the total number of individuals responded and not responded. And then U and V, that we consider set of individuals. Then once the now total numbers are known, then the set of individuals who are responded to the survey and set of individuals who have not responded to the survey also we know. And then the set of individuals who have responded, I mean, those individuals who responded are also part of the total number of people who are living in that particular area. And then two events are considered. One event is those N out of N responded are identified and N out of I only responded. So what is the event of response and event of identified by the AI model among the respondents? Two events. One is event of response for an app or for a mobile app, and then among the respondent, the event of having identified AI model identifying among respondents. So two events are happening there. And then the probability of identifying using the AI model. So using the two cases, the probability that N1, small number of N1 cases are identified through AI framework, given that there are N individuals responded is N1 multiplied by N by N square. This is the summary result, and then rest of the talk you all heard. Yeah. Thank you. Thanks for asking me to present again that part of the piece. Yeah, I don't know how these lines are coming. This is not created by me.
Thank you, sir, for this wonderful talk. You have explained very lucidly. Not many mathematical terms have used, so it was easy to understand, I think, to all the participants. Now, actually, we have, as there is no, if anyone can want to ask any queries, he or she can ask. Or otherwise, we are going to enter the session. So I request our IQAC coordinator, Dr. Kamala Mitra, to go to things.
Good evening. Am I audible?
Yes.
Yes,
On behalf of IQAC, I take the opportunity to convey my gratitude to our principal, Dr. Shamul Kormokar, who has always motivating us with his unrelenting zeal to pursue excellence in academic field. I thank you very much, sir, for your guidance and support. On behalf of organizing committee, I express my heartiest gratitude to our honorable speaker, Dr. Rao, for his informative and interesting presentation. I thank you for his acceptance of our invitation with busy schedule. This is an absolute pleasure and honor for us to host him. Thank you again, sir. I express my thankfulness to our dear participants who cooperated us in every stage of this academic venture. I, on behalf of organizing team, give special thanks to our entire technical team for their continuous support. Hope all you enjoyed the session and enriched yourself with valuable information. Finally, thanks to the convener, Dr. Tisha Moitro, for organizing such a beautiful webinar. Thank you to all. Thank you, Trisha, again. Thank you, sir.
thank you, ma'am. One of the participants called Moloy actually just asked that he has some queries. So Moloy, will you want to ask? I think
Vishali, there is a question from Shormishta. What is the main factor responsible for the flattening of the epidemic curve?
Yeah, that's a
question here. You can over to you, sir. You can ask again to sir directly. I didn't find the question.
yeah, that's a good question.
There is a question in the chat box from Shormishta. She is asking about what is the main factor responsible for the flattening of the epidemic curve?
Correct. That's a very good question. In fact, the flattening of a curve, it is one of the central aspects of epidemiology. As we say, suppose let us take a Bonugli, small area, which is very small area with GLD road and suppose we confine to Bonugli area, and then suppose that particular area individuals have not been. I mean, they are all are quarantined within a area, but among themselves they can suppose they all can interact, but they are not able to. Bonugli area people are not able to suppose interact outside rest of the Kolkata people. Suppose that particular area, and we want to find out the flattening of the coronavirus within a Bonugli area. Suppose confined to that, then all the individuals in the Bonugli area. Suppose we test in a 1 day. 1 day we finish testing of all for the coronavirus. Then what happens? Within a day, we know that how many positive individuals are there in particular area. Then the peak, that means the second day we will able to quarantine them, isn't it? First day we identify everybody we test everybody, and then we identify them. That means they're all quarantined. That means there is a good chance that the disease would not spread. That means whatever we observed in the first day after testing everybody, that would be the peak. Suppose we don't test every day, we test 20 or 50 or 100 individuals or some finite number of small individuals per day in Bonugli area, and we keep on testing every day a certain number of individuals. Then what happens? Then the individuals who have not been tested, among them also there could be some positive individuals, and they would be spreading, and we don't know their status. The hospitals would, the government don't know their status, and the individuals also don't know the status. Hence the flattening will be delayed. So if the random mixing is happening in the population, then the flattening, understanding the flattening is not that easy, because the mixing is happening. Of course, one can build a mathematical model, a simpler, complicated, without any relation with the ground reality. That's a different thing. But in reality, flattening depends on number of individuals who are positive in the population and number of individuals who have been tested.
So one more question. One of the participants, Shobnak, has asked how to learn more about epidemiology prediction models like SIS or SIR models, and which programming environment is preferable to use to code prediction models.
Well, Calcutta, we have, the historically lot of good work has been done back in Calcutta University, Jadavpur University, Indian Statistical Institute, or Bengal College of Engineering, BESU. So all these, they have been doing a good amount of work on the epidemiological model. So I would say recommend, as you start the data, you understand differential equations, we all learn in the BSc level. And then these differential equation models, one can start with the SIR model and understand the stability properties, how the epidemic curve changes, all these things, one can start with the basic plotting, and then anything, R, Mathematica, MATLAB, many softwares are there, which can, help them to just start the playing, or C programming, Fortran, anything, that's a beautiful way. There are then once they are mastered about the undergraduate, level, the differential equation, all these things, then they can also explore the algebraic methods and other like graph theoretical methods, various other things, because the math is about you need to solve the problem. It's not that I know certain tools, I want to apply everywhere the same tools. No, that doesn't work like that in reality. In reality, it works for practical implementation. You need to be flexible to use any type of mathematical tools for practically using them to solve it. Either be it could be stochastic, be it could be deterministic, be it could be graph theoretical, be it could be algebraic, any type of depending on the need of that particular situation.
So actually,
And then when I was there teaching back in Indian Statistical Institute, I had brilliant students there to teach for the undergraduate. So I used to use the same, even as teaching differential equation course, I used to introduce a lot of as examples or several epidemic models as a starters.
sir, can it be possible to explain shortly about the technique about the spread of virus? One of the the prediction of spreading of virus. One of the participant had asked about the techniques. Can you shortly explain how we have used, which formula we have used or something?
You mean the software?
I don't know, sir. Actually, yeah, she has asked that. 1 second, sir. 1 second. She has asked about the techniques or mathematical formulas used to predict the spread of virus. So,
Okay, I don't have readily in my slide here. I'm sorry for that, but then they can
so
start
maybe you
with
give the idea
yeah,
related to.
exactly. So I can explain in verbally. You take 3 compartments. First of all, you start with a simple model like consider a Mahalanobis area, and then say today July 7th. July 7th, you distribute the total Mahalanobis area people into 3 compartments. One, those who have say first let us start 2 compartments. Those who have virus in them, in COVID virus, and those who do not have 2 compartments. So you got 2 compartments. Now these 2 compartments, one need to link these 2 compartments, because the infection from those who have infected, they would transmit to the non-infected. So this is a compartmental modeling. So those who are infected, when they transmit to the non-infected, this transmission is coupled through differential. They are coupled through a model that we call coupled differential equations. So at a rate of what is the rate of transmission from a compartment, non-infected compartment would acquire from an infected compartment? That acquiring. So that acquiring is, the mathematical model is nothing but a translation, like we translate from Bangla to Japanese, Japanese to Chinese, one language to another language. Just like naturally what is happening in the population, that translation of the population level dynamics into a language of mathematics, that's called modeling. And modeling is nothing but now 2 compartments are there. Now we have some transmission rate. At what rate that transmission occurring? So that transmission rate parameter multiplied by the number of susceptibles. Susceptible means those who are ready to acquire, infected those who are already have the virus. So these 2 interact. The interacting factors is like beta transmission rate. We multiply by the interacting factors like susceptibles, and then we multiply by the infected and they divide by the total number of individuals. That would get an incidence. New infected cases per day or per week or per unit time. So then we get the unit time. So mathematical model would help us to understand the number of new cases per unit time. That's how this is like a simple translation only. And as you see, this is a model. Model need not be true. Like we all see that the same example I used to teach back in when I was teaching there. Suppose we consider Earth or the planet as a sphere. Most of us, we say that, the sphere. But we know that, the sphere has a smooth surface. But Earth would never have, Earth do not have a sphere, like a smooth surface. It has mountains, it has valleys. But we model Earth as a sphere. So this model is a close resemblance of the reality. It need not be always exact truth. And this is a mathematical setup. But it is suppose we consider stochastic setup. In a stochastic model, what are the key things? stochastic things, what there is a space, that's called state space. So we have a space where several states of an individual. Now say susceptibility or the infected individual, the two states if you consider, an individual could be either susceptible or infected, suppose say, then these two are two states of a population. Now you have a randomness. That means if a individual randomly oscillating between these two, and then you develop a model to predict the probability that given a time, the individual will be in a particular state. Now there's a probabilistic. You are not predicting the numbers. In the first case, you predicted the number of new cases. That's a raw number. But in second case, you are interested to what is the probability that any given time point in Bernoulli, what is the probability that given individual is susceptible? Or what is the probability that given individual is infected? That's a probabilistic. So then you need to build a stochastic model. So that means if you know only a mathematical model and then I want to build only mathematical model, but then you cannot answer this, one cannot answer the second type of questions to understand that if I randomly pick an individual from Bernoulli standing at the Dunlop bus stand and pick an individual and randomly test, what is the probability that that particular individual is infected? That mathematical models cannot answer. For that, one has to build a stochastic model, and then that sort of data, population level analysis, and then given individual, then that probability, whatever you find out, need not be true for every individual. Like we see that we compute the average of individuals. Suppose we compute like human average height of individual, then average height need not be true for any of the individuals. That's just an average. Similarly, the mathematical model will say the number and probabilistic. One can predict the probability of having, one can predict the number of having. So that article, what I quoted in the JTB, Journal of Theoretical Biology, it has all the details. And then whatever I described here, the plague epidemic, and it has a historical that we described in the beginning, as a referee asked, historically the 1940s, 1950s, how the various epidemics occurred, and then how at that time simple models have been started. So one can look into the details there.
Thank you, sir. Due to time constraint, actually, we have to end today's webinar. So we are concluding our session and hope to meet all in a COVID-free better world. Thank you, sir. And thank you to all the participants.
Okay. Thank you, Dr. Maitra. Thank you.
Thank you. We are ending today's session.
Namaskar.
End coach.
Yes, madam. End court.